Hello everybody and welcome to this presentation on alopecia areata. My name is Dr. Elham Mutahar. I am a consultant in dermatology. Today we will diving into this fascinating and often misunderstood condition. This condition impacts millions of people worldwide, affecting their appearance, self-esteem, and overall well-being. Hair on our body is important. The scalp contains around 100,000 hair follicles that keep the scalp moist. In addition, the hair in our nose protect us against dust. Also, the hair in our eye, brows, and eyelashes protect us from sunlight and infection. This presentation includes the definition of alopecia areata, the hair cycle, trichology, causes and types of alopecia areata. Additionally, it also confirms the diagnosis of the alopecia areata, differential diagnosis, and treatment. So hair makes our appearance beautiful and indicates the state of our health. So what's the definition of alopecia areata? It is an autoimmune disease that affects the hair follicles, which leads to hair loss on the scalp and hair-bearing area of the body. The clinical picture includes a sudden onset of hair loss. The hair cycle. The hair cycle passes into three phases: the anagen phase, and catagen phase, and telogen phase. The anagen phase is the state of active growth, producing new cells. It takes 2 to 6 years. The catagen phase stops growing, detaching slowly, and it takes 2 to 4 weeks. The last phase is the telogen phase, which follicle rest and prepare next cycle. It takes 3 to 5 months. So what the cause of alopecia areata? First, genetic hypothesis, which involved the numbers of the human lactate antigen classic 1 and 2 alleles, in addition to several alleles at the interferon gamma pathway, with relative cytokines and mediated by JAK kinase. The second causes is alopecia areata is associated with certain diseases such as vitiligo, thyroid diseases, Down syndrome, and pernicious anemia. The last one of causes is stress and psychological condition. The clinical types of the alopecia areata. As you see in the first photo, there is called the focal alopecia areata. It is well demarcated hair loss on the scalp or any other hair-bearing area in the body. The second photo is called the alopecia totalis. It is complete hair loss on the scalp. As you see, in the Alopecia areata universalis, it is complete hair loss in all hair-bearing areas, As you see in this first photo, the student experienced sudden hair loss due to stress from GCSE exam. That is the anxiety triggered by this stress type. As you see in this photo, this student complete hair loss from scalp, eyelashes, and eyebrows. The other type of alopecia areata ophisis, it is a band hair loss on the occipital and temporal area. As you see in the this child has ophisis on the occipital area. Sisyphus alopecia, it is hair loss on the frontal area of the scalp, parietal and temporal area. Also, there is a type of alopecia areata oceagnata, as you see in this photo, the second one. It is rapid and widespread hair loss. Marie Antoinette syndrome, as you see in this child, he has gray hair due to stress, emotional and physical stress, causes sudden overnight gray hair. One of the most famous stories about sudden hair loss is Queen Marie Antoinette of France. Legend has it that on the night before her execution during the French Revolution, this condition is known as Marie Antoinette syndrome. That means the emotional or physical stress can lead to sudden patchy hair loss or even change in hair color. So, how confirm the diagnosis of alopecia areata? By trichoscopic, the dermoscopy revealed exclamation point hair with yellow or black dots. The hair pull test, it includes grasping around 40 hair follicles with gentle extraction. It will be easy. Pull out that mean positive alopecia areata. The last confirm of the diagnosis with a skin biopsy. The histopathology showed P-swarm pattern of lymphocytic infiltration at the antigen phase. So, differential diagnosis of alopecia areata. There is many disease similar to the alopecia areata, as the tinea capitis, trichotillomania condition, autoimmune disease such as systemic lupus erythematosus, alopecia areata due to secondary syphilis, lichen planopilaris, and then also it could be due to post-traumatic or surgical telogen effluvium. The treatment of alopecia areata, there is many types of the treatment, including a local corticosteroid such as betenovate or cliptazole in mild and moderate case. Also, the intralesion corticosteroids such as triamcinolone, acetinoid, particularly in patches or focal alopecia areata. It is very effective in this type of alopecia areata. There are many brands of minoxidil spray and bibenthane solution available in over-the-counter. This type is called the local treatment. If the condition not responds to this type for the treatment, we will shift to systemic treatment, including systemic corticosteroids, such as prednisolone with 6 weeks of tapering, immunotherapy such as contact immunotherapy, diphenyl cyclopropanol, and immunosuppressant methotrexate. The other type of the treatment also is laser treatment with excimer laser and phototherapy with soraline and narrowband ultraviolet bay. I have one patient in my clinic. This patient photo was in my clinic. The patient aged 20 years who has been diagnosed with alopecia areata. On examination, she had well demarcated patches on the scalp area in the scalp area. Here, relative blood tests include low serum iron level. She had been treated with intralesion triamcinolone and betnovate scalp application, in addition to iron supplements for 3 months. That result in a complete cure of her condition. So the conclusion of this presentation: alopecia is an autoimmune disease. The individuals respond to the treatment depend on the control of the cause, aggravating factor, and their immunity. The characteristic appearance of alopecia cause impairment for the patient that result in affecting personal job, social activity, and anxiety. Also may lead to patient depression. It is important for early diagnosis and treatment of alopecia areata. Thank you for attention for this presentation. If you like this presentation, please press subscription for me. Thank you. Bye.